Kia ora tātou katoa I rau rangatira mā. Ko wai au, ko aura ki te mauka, ko waisa ki te awa, ko takitimu te waka, ko tāhu pōta ki te takata, ko rua hekihi te hāpū, ko kaitahu te iwi, ko o tākau taku marae, ko Jane Stevens taku ingoa. I'm not a doctor. I'm not a mental... Thank you. A doctor of life, that's great. And a mum, and a member of a whānau who've been battling at the coalface from a place of pain, but a place of passion for transformational change that we need to our mental health system. And I carry on my shoulder many of other whānau who, like us, have been through tragic circumstances that have pushed us to really try and bring our voices to the fore and work for transformational change. And what I'm trying to do today is to really share with you some of the kōrero that we have had together and that we have tried to articulate to all the powers that be, to our communities, to other whānau, to support that journey. And I've been really inspired this morning to hear what's happening from an organisational basis. But at times it feels like our voices as whānau are not heard. So I felt it was really important to be able to stand here today. And given that we've got a speed date, I've tried to condense both the context in which myself and other whānau speak from, and also some of the solutions that we have discussed. So I've actually written them down to try and make my way through them. Some of you who will know me know that I could spend all day up here, so I'm trying to avoid that. And this is my first attempt at technological excellence using a computer, so aroha mai. So firstly, all of our people should have equitable access to mental health care and support that is accessible, appropriate, effective, and that enables people to live well and live meaningful, rewarding lives. A declaration that I assume that we can all agree with, and one that should not be hard to achieve. But shamefully, we are nowhere near achieving what I believe is a basic principle of any caring society. Instead, we are international leaders in appalling mental health outcomes and suicide. Our mental health system is a train wreck. And from where I stand, not much has changed, despite the government's mental health inquiry and despite the financial resources that have been committed by government. The move to truly inclusive, Indigenous, flax roots and collaborative responses that are required to achieve the effective change for people like our whānau who are suffering and people who are dying unnecessarily haven't yet been put in place. That's going to take social change that many in power still refuse to enact, despite all the talk about the need for radical transformation of our mental health systems. I know this because I've spent the last 10 years at the coalface of our mental health system. Firstly, as a mother fighting for her son's life and failing, and then as an advocate with whānau who have had their lives also turned upside down by the escalation of suicide, mental distress and illness in this country. Our growing mental health and suicide epidemic is a horrific outcome of the many years of financial neglect, discrimination and inequity that has typified our approach to mental health and suicide. It's been put in the too hard basket time and time again. Successive governments have ignored the need for investment. They have ignored the need for real leadership and radical transformation of the way we do mental health in Aotearoa. This neglect resulted in the death of my son Nicky in 2015, He became one of the many casualties of the grossly underfunded and archaic mental health system that is too often killing rather than curing our loved ones. I'm here today because my whānau and many more like ours need to know that there is still a chance to move from the business as usual approach that has so badly failed us. My focus today is on those solutions that contribute to building a socially and economically just and equitable society that prioritises the mental health and well-being of all its people, a society that takes a holistic approach to keeping our whānau healthy and well. Many people post-COVID-19 lockdown are saying now that the moment for resetting our values and our priorities is now. That now is the time for an economy that puts people rather than financial gain first. That now is the time to put whānau, community, equity, resilience, kindness and compassion to the fore. I agree. These are all basic tenets of good health and well-being, much more so than the single bottom line economy that has done so much for so few. I'd now like to share some of the key actions for change that are an amalgamation of conversations that we've had as whānau and things that we believe are needed for those changes that we want to see in mental health. None of them are new and none of them are rocket science. In fact, they're all things that are 101 common sense. But as a country, we're a long, long, long way off achieving them. Now's the time for us to move away from dominant Western models that marginalise those who don't fit its rigid boundaries and condemn people to lives lived in poverty, violence, alienation, addiction, trauma, homelessness, illness and premature death. Now is the time to be fully committed to achieving equitable health outcomes for Māori. We should have grown up enough as a country by now to have embedded tino rangatiratanga into our values and principles as a country. Now is the time for a major shift in priorities in all sectors, away from those that are purely economic and individualistic, to priorities that are founded on equitable social and economic well-being. Now is the time to grow our collective action and responsibility. We did it as the team of 5 million with COVID-19. Let's embed it into our values systems and processes going forward. Now is the time to ensure that we fully developed a whānau ora model of healthcare that is truly whānau-centred, whānau-driven, with responsive and appropriate systems, services and support. Now is the time to commit to building strong, genuine relationships and partnerships between decision makers and stakeholders that are truly inclusive, collaborative and respectful. Now is the time to give local communities the power and resources to find local solutions. Now is the time to develop strategies that are strength-based, that build community capital, resilience, vibrancy, capability, inclusion and leadership. Now is the time to implement sustainable long-term resourcing of holistic, community-based approaches to preventative and restorative health strategies. Now is the time to embrace and include flax roots, lived experience, advocacy and leadership at all levels of planning and decision making. And now is the time to embed transparency and accountability into our health systems and our leadership. We should not have to continue tolerating leadership that perpetuates processes and culture that harm, are inequitable and refuse to take responsibility for the tragic health outcomes we are now confronted with. And how do we achieve this? People have talked already today about how flax roots change happens because of movements of people who want to build a decent and meaningful life and who are often compelled by circumstances that threaten or impact themselves and those they love. In this country, the voice of people have been loud and clear in regard to the mental health crisis we are facing. The discrimination and exclusion, silence and stigma around mental health and suicide is being challenged by people. People are questioning the status quo and repeatedly calling for change. Mental health and suicide are finally becoming accepted as key societal issues. It wasn't that long ago that we just didn't talk about it. But the people that we love are still dying in increasingly terrifying numbers. People are still struggling to get access to any services or any support. Whānau are still suffering the consequences of our failing mental health system. There's a lot of talk about transformation. It's become a real catchword, and one I'm getting pretty tired of, because I don't believe that a lot of the people using those words even know what it means, particularly those still leading in our institutions. I believe that for transformation to actually happen, we first need to transform those structures and that leadership within the health sector. That's where it's fallen over. We don't have the leadership willing or able to make the hard calls, and in my experience, many of them don't even know how. I challenge our elected leaders to work together to create the environment for a society that is focused on equity of access, outcomes and opportunities for all our people, not just the privileged few. Whoever is in government, those in business or in any positions of power and decision-making going forward from now, will need to think deeply and act decisively on the people's calls for change. Business as usual is not okay anymore. Kia ora.
Tēnā koe.